Good day, everybody. This is Chris with the Ancient Scholar, and today I'd like to do just a quick video. This is more of a follow-up video on the regarding the fluid mechanics, fluid dynamics playlist for respiratory care, and this is actually a response to a couple of conversations I've had through the messages, the comments section on a couple of the videos with hopefully I get this name right. It's Christopher New, I believe. I may be wrong on the enunciating the last name, so all apologies if that's the case, if I mispronounced that. But he brought up some really good points. I just want to make sure that everybody's on the same page as far as the symbology / terminology goes. Because when you look at things, say through more of a physics, mechanics, engineering perspective, there are many other concepts that need to be considered. So when I use some of the symbols, I'm really trying to focus on the physiological application of these concepts, and there is sometimes a difference in how things look like in physiology versus other fields. There's some subtleties that happen there. So what I want to do is just kind of keep this video basic for now, and if there's some interest and people want to dive into a little more about what's the difference between something like flow and flux, and are there some formal mathematics that we can use to kind of better understand and describe some of these things. I might consider those in other videos, but this video I just want to be real basic and just make sure that we're good with the basic concepts. So oftentimes in some of the formulas I use the following. You may see the following things: a Q with a dot on top of it, and then a V with a dot on top of it. And in a physiological context, so again, we're talking physiology in a physiological context, so we talk about physiology. The meaning, these things basically mean the same thing. The V and the Q basically mean the same thing, and V/Q basically means some sort of volume. Okay, some sort of volume, and then a V dot/Q dot is, if you know calculus, you're basically just taking a time derivative. It's a first derivative with respect to time, but in a non-calculus concept, it's just a very practical concept. That just means volume. Okay, volume per time. All right, so certain volume per a certain amount of time. We typically, in physiology, again, we typically use liters, and depending on the context, either second or sometimes minute. Okay, so liters of volume per minute. Now, in physiology, you basically have two areas of the body where you have significant, really all this is flow. Okay, this is what flow is. Flow is just a certain volume of material moving per time. Now again, there are formal ways of talking about this that can get a bit more complicated. I'm just keeping this simple for now. But when we talk about this is just another way of talking about a flow of a fluid, and there are basically two types of fluid in the body that we talk about in physiology, and that is we talk about the gas. Okay, gas is a fluid. It flows, so it can certainly be described as a fluid. You talk about the flow of gas, and that's primarily in the respiratory system. Okay, and then you have the flow of blood. Okay, which is primarily in the circulatory system. And so in physiology, we like a kind of a different symbol for each of these to kind of keep them separate. So again, in physiology, when I'm talking about the flow of a gas, when I'm talking about the flow of a gas, we're typically going to have V dot. Okay, V dot is going to be the flow of gas, and that again is either in liters per minute or sometimes liters per second. Okay, depending on how we're dealing. Blood flow is Q dot, and it's the same measurement, liters per minute or sometimes liters per second or milliliters per second, as the case may be, just depending on where the flow is. And then oftentimes what we'll do is there will be a little subscript after this to further differentiate where the flow is. For example, you may see something like Q dot, little subscript C there, and what we're talking about is we're talking about capillary blood flow versus flow in other parts of the body. So you may see that as well. Okay, guys, I'm going to go ahead and cut it off here, but hopefully at a very basic intuitive level, this symbology, if you will, makes a little more intuitive sense. And I do apologize if I ended up interchanging these somewhere and I used Q dot where I should have used V dot and vice versa. So all apologies if I did that in any of the videos, but hopefully this kind of brought that all together and put everybody on the same page as far as a physiological context goes. Okay, guys, as always, thanks for hanging in there.